I've had a lot of laser, a lot of fillers, a lot of thread lifts, a lot of skin quality improvements. Realistic expectations with Botox. It is a losing battle as we age. Age doesn't really matter. I mean, if you're young, so the longer you wait, the harder that wrinkle is to get rid of because it's kind of etched into your face now. Hi, Dr. Jessie Cheung here. If you don't know me, I am a dermatologist out of the suburban Chicago area and also New York City. Today we're going to talk about Botox, one of my favorite buddies. I've been getting Botox for 20 years, and so if you've never had Botox and are afraid about it, we're going to go through what it does, some myths, and what you really should be looking for in your Botox provider. So what does Botox do? Botox is botulinum toxin. It is actually a chemical poison. So in small amounts, what it does, it relaxes wrinkles. We use it therapeutically, medicinally, for good purposes. So it's relaxing the muscles, and so when you relax muscles in the face, it makes wrinkles not happen when you're animating and moving. We could also use it to lift muscles because there's certain muscles in the face that when you relax them, your skin actually looks higher. So we use it to our advantage when we're trying to open up the eyes. We'll relax this muscle area here because this muscle does this to you. Normally she looks angry. So when you relax this muscle pull, you look more open and happier. When you relax the muscles around the eyes, instead of getting those crow's feet that make us look tired, we're opening that up so you look more opened and less tired. Botox is also great for shrinking muscles that we don't want to be too big. So if you're someone who grinds their muscles or clenches their teeth, these muscles here get very big and it can actually cause bone loss over time. So you can Botox the masseter muscle in the edge of the jaw, and when you Botox it, it's going to make it harder for you to clench and grind when you're not thinking about it. It also shrinks the muscle back down to its normal size, so you kind of preserve that bone over time. You also shrink your temporalis muscle in the back. We like to use it on the body for shrinking, shoulders that are overbuilt over time, or if you want to have a slimmer calf muscle, if you're trying to get those boots on your legs, you can't zip them up. You can actually put Botox here to shrink the muscles in that area. We also love using Botox for pain relief. When you inject a muscle that's very tight with knots and bad circulation, Botoxing that muscle will actually help to relax it so you get the blood flow back and you get, correction that big knot of pain in that area. So I get it to myself because I inject people all day long. My shoulders do get very worn out and overbuilt. So I've Botoxed my shoulders many times over the past few years to keep them slim, but also to help with the pain in that area. So there's many uses of Botox beyond just wrinkles and muscle shaping. We actually use Botox for sexual health. You can Botox the penis. And what does that do for the penis? So we're targeting the smooth muscles and the blood vessels in that erectile function part of the penis, the corpus cavernosum. When you Botox the blood vessels there, they stay more open when you're flaccid, so you actually look thicker and you hang longer. When you have an erection, it actually helps to keep the blood in that area, so you get that much more of a stronger erection. My guys who've had it done, they are happy with the size and length. They're showing off their organ, but also they have noticed more spontaneous erections. Morning wood comes back. We think there's some sort of nerve benefit by Botoxing those muscles. It's very interesting. In dermatology, we use Botox off-label. It helps with hair growth if you've been in the scalp. It actually helps with rosacea to help make the blood vessels less spastic. So if you're someone who turns red and you flush and blush very easily, Botoxing that will actually help to make you not turn red as often. You can also use it to treat melasma. Melasma is a pigment disorder. Basically, you get these brown patches on your face from sun, hormones, other things like that. But Botoxing will help to stabilize those color cells so your melasma doesn't progress. For sweating. We love Botox for sweating. But that was my first time I got Botox. We did my armpits just because I didn't have any wrinkles yet, right? When you inject Botox into sweat glands, the nerves that actually open and release the vesicles that make you sweat. So you won't sweat for about 3 to 4 to 5, 6 months, depending on how much you put in. So let's get into, pricing and how much Botox you want to get. We know with Botox, if you're someone who, doesn't like to sweat, or if you have pain, things like that, big muscles, of course you can use Botox to shrink them down and reduce sweating. For wrinkles, which is what's the most common use of Botox is, if you're someone who has bigger muscles in your face that cause those deeper wrinkles when you animate, Botox is great because it is pretty much almost instant gratification. Most Botox kicks in without 3 or 4 days after injection. You'll see the muscles kind of calming down your heart. It's harder for you to make those frowny expression lines. Age doesn't really matter. I mean, if you're young, some young patients in their 20s, they have those big muscles and they're starting to get those wrinkles. And it's good to start younger because less of a bigger wrinkle to treat. The longer you wait, the harder that wrinkle is to get rid of because it's kind of etched into your face now. So I'm a huge fan of preventative Botox. That's what I had back in the day in my 20s. My muscles were getting bigger. I didn't have any lines etched into my skin, but I didn't want them to happen. So I started Botoxing my face and I am very happy with all my Botox. But if you are older and you have those deeper lines, it's okay. We Botox them and they work on making the skin healthier with lasers or peels or skincare and boosters. All those will help to erase that etched in line. Realistic expectations with Botox. Well, we want you to look natural, right? We want you to be frozen because that doesn't look natural. You don't want to freeze the eye muscles too much because when you smile, it doesn't move, which looks fake, and your smile actually looks smaller because you can't lift those muscles as high to open up your mouth. So we really want to avoid the frozen look, which is what we were doing maybe 20 years ago when we didn't really understand dosing as much. We were putting too much in and really knocking out that whole muscle so you look kind of frozen and weird. Nowadays, nowadays you could do more baby Botox, which is maybe less Botox all throughout, so you can retain some animation and not be frozen. But we know what that is, your Botox may not last as long because we're putting less Botox in. We know that dose equals duration with Botox. So if you have a muscle, we kind of know the standard doses for that area to get 3 to 4 months of longevity. If you underdose, you're still gonna, it's gonna work, it's just it won't last as long. And we see that happening at some places nowadays because they don't want to put as much in for whatever reason, price-wise, things like that. So talk to your injector and make sure you want that duration. You want enough units of Botox to get the look that you want to have for that length of time. Cost of treatment, the cost of Botox, I think it really varies depending on who your injector is, where you're going. I would say that less experienced injectors probably tend to underprice their Botox treatments because they want to get busy, which is great. The Botox is better for everybody. People who are more experienced, their time is worth more because they do more complicated treatments. They tend to charge a little bit more, which is fair because they have that much more experience. Because Botox, it's relatively easy to learn and do, but there are little differences that you learn over experience over time. Certain injection patterns or certain depths that you're injecting to get the results that you want. It is good to go to someone who's experienced if you have a complicated, complicated anatomy, let's say. One thing we love about Botox, we love micro Botox, which I don't know if you've heard of. Instead of targeting the deep muscles of the face where to prevent the wrinkles and the muscles from moving, we're targeting the superficial little fibers that connect into the top layers of your skin. When you put Botox there very superficially, we're not freezing you, we're just making your skin look tighter and smoother and making your pores disappear. And how does that work? Well, the fibroblast actually contracts, your skin looks tighter, you look smoother because those little baby wrinkles really just disappear because we're putting that little pulling action. And then because we're getting increased glow in the skin, we're keeping the water in the skin actually, so you look really glowy and firm and tight. And then we also just see no pores. You have this glass skin look, which is really awesome. Patients really love their micro Botox. So think of it this way, Botox, it is a losing battle as we age, right? Because as we age, we're gonna lose the bone and the skin that sandwiches the muscle back into place. The reason why we need Botox as we get older, because the support around the muscle starts to go, we lose the bone, the fat, the muscle, the skin starts to get more saggy, your muscles get stronger. And that's why we need to use Botox to relax them back down. But if we could work on the sandwich, the bread around the muscle, we could work on your bone density, your fat layers, your skin quality. That's gonna make you not need as much Botox because the muscle is sandwiched back into place and it relaxes a little bit. So my goal is to not need as much Botox as I get older. And I've been getting Botox for 20 years. I use less than I did back in the day because I've had a lot of laser, a lot of fillers, a lot of thread lifts, a lot of skin quality improvements. And so this, I Botox maybe once a year. It doesn't really move much because I've had Botox for 20 years. My muscle's been shrunken. I've trained my muscles to not move, but I've also had a lot of laser skin tightening in this area to keep my skin and keep my muscle back sandwiched into place. So yes, it is a losing battle over time. We love it, it's a great tool, but there are other things you can do to make you not need as much Botox as you age. So if you're curious about what Botox can do to you, go see a qualified injector, someone who's been doing it for quite a while, and tell them what your concerns are. If you're starting to get little baby wrinkles that are getting etched into your forehead, or if you hate the crow's feet, or if you have these really big bulky muscles, put yourself in their hands, see what they recommend, and if you like what they're saying, I think it would be cool to have a treatment, experience it for the first time. Most people do love their Botox. And also if you're in Chicago or New York area, I would love to see you and do your first Botox for you. If you like the content in this, drop a like down below or leave a comment to tell us what you'd love to hear more about.